There are two beautiful judgments are there in this case. Once he gets discharged, he can file a case or not. This is your right.
No, sir. Suppose something has happened to the patient on table test. In emergency we have taken the patient, and on table test has happened, and we have not taken any bill from that patient. Is he still liable to file a case against the hospital?
See, there is no immunity for the doctor stating that patient has not paid the bill, so he is not entitled to file a case against you. So if the genuinely there is a negligence on the part of the doctor or the deficient service of the doctor, whether he pays a bill or not, still he can file a case against you. The court says that do not accept the thing the same line. Even if you have not paid the bill, he can file a case against you, he can sue, no doubt about it. But the recovery of the bill is different and filing of the case against you is different. So what I suggest to you is, many times what happened was, in one of the cases, recently in Tumkur, I think, probably, they said that the patient has not paid a bill of 1,28,000 rupees and is filing a case. The court category said that then why did you waive it off? When you have waived it off, even you are not made an effort to recover a bill even for the 2 years, it means that a word of guilt lies with you. Then he said that I have been trying my best, they never came back to me. Probably he could have filed a civil suit on them, which you have not done. So that the waiving of the fees or paying the bill are two different decisions, whether you have paid or not, but still you are vulnerable to get the legal notice from any of the courts if the patient or patient relative determines.
So about question, you told about consent, written consent. So being we take the written consent, that is applicable everywhere for any operations and all. So does it stand or whether we have to write it specifically for? This case.
This is the medico-legal post of challenges still is pending, but still, see, consent is not what you take a signature on a piece of paper. It has to be a procedure specific, and it's the process. So it's agreement between you and the party. Okay, many times you ask the sisters to take the consent. Okay, so I have seen normally consent form can scrutinize it. So there is an agreement between you and the patient. The patient or the legal head, they have signed it. There is no signature of the doctors. So again, it's the breach of contract. It's a breach of contract. So even if it's a bit late, there is a space. Nursing home seal and the doctor's signature. Once the procedure is over, rather than putting it in the MRE, medical-legal section, make sure that you sign it without anybody's knowledge. Because once the case is filed against you, the case papers are scrutinized. Probably if your signatures are not there, probably patient party would say that it's a unilateral consent and doctor has not signed it. So make sure that, and the standard protocols which are like a pre-printed form, still they hold good. Because we have filed argued stating that even the chartered accountants and the bank checkbooks, okay, they are all pre-printed, right? Okay, so in this scenario, we have been fighting in the Supreme Court to revert back to that. We have to wait and see. Anything, sir? Yeah. I think
you told that because the patient has not paid the bill as doctor's suggestion was, and even though they have not collected any money, they have not considered anything, yet we are liable for the suit as well as the compensation. If that is so, why the government medical officers are let off? They do not, they are not, they are also in terms of doctor and patient relation, they have treated, and if the agreement is there, it is between the medical officer and indirectly the government of Karnataka. Correct. Yeah. Here you are talking, you quoted an incidence of insurance company.
Yeah.
So here is the maximum coverage that for any government thing is the government of the state. So if government doctors have got the immunity, against the consumer forum.
Why not?
The people who have not collected anything and they have done it free at the very outset, they have not collected the fee, how can they be liable?
Yeah. In this, I'll tell you, who are exempted from the Consumer Protection Act, either in the old act or new act? The one nursing home who treat the patient totally free, whether rich or poor. All hospitals, all patients admitted in hospital are totally free. Any petty amount which they have given, maybe in the government hospital 5 rupees for the consultation, 20 rupees for the X-ray, CBC 50 rupees, RBS 25 rupees.
They are paying the receipt now.
I'll tell you. See, the court has interpreted all these cases some sort of a consideration of what they have paid for the services, even though it's a government doctor. So recently, 4 or 5 judgments are there. Government doctors are also not exempted nowadays.
They are liable.
Government doctors are also under the ambit of the Consumer Protection Act in the recent past. Earlier, doctors, yes, they used to take it very lightly because government doctors are exempted. Of late, most of the different states also, they have taken all the government doctors the ambit of the Consumer Protection Act. There is no excuse for that.
So the government servants are also liable.
Yes, 100%,
Stand on the equal footing.
100%, 100%.
Sir, one more question.
Yeah.
Sir, physician opinion, whether body, surgery and all. So is it mandatory? That is first question.
Yeah.
And this one, even suppose it is not mandatory also. If you take that physician opinion, does it help in your this one?
Yeah.
Proceeding at all?
This is the day-to-day practice, as Anna said, I also face it. Many times we say that as a physician fitness, you want to say, right?
Yeah.
Physician, yeah. See, many times you see to that physician fitness. Physician fitness is a misnomer. Okay? If you interpret the fitness word, it amounts to somewhere, in some angle, you are giving some sort of a warranty or guarantee. This is my first observation. So why do we need a physician fitness? Fitness is a misnomer, my dear friends. So why do you ask the particular person for a physician fitness or physician opinion means? Physician opinion means if the patient has a comorbid conditions, okay, ultimately our aim is not to harm the patient, there has to be a good output, whatever may be. The patient may die, morbidity or mortality is a different issue. So, when the patient has a comorbid conditions, wherein you need to take his help to optimize the comorbid conditions. For example, the blood pressure is 160 by 120, there is an emergency laparotomy and elective hernia operation, herniatomy, whatever it is. So, as an anesthetist, it is our duty to refer him to the physician, stating that he is uncontrolled hypertension. Try to optimize him. You got it? So he optimizes, and the patient being optimized. This is called as optimization of the patient in consultation with the physician. This is required. Okay? And we ourselves, even after 20-25 years, earlier I never used to take any physician opinion. I used to put antihypertensive and insulin, I used to take that. But days have not changed a lot. The opposing lawyer would ask you, probably in some angle you also feel that probably I would have taken. If you are in doubt of ECG, again the best thing is to take the cardiologist opinion. So even if other way around, many times it happens there that you are reluctant to give anesthesia with a BP of 160 by 100. We say that it is not controlled. And surgeon says that now physician has seen, cardiologist has seen it, they are given a fitness. So it's a double-edged weapon. If you deliberately go and give anesthesia, something goes in the table, you are held liable. The court in one or two cases categorically said that why did we accept the opinion of the physician and the cardiologist? It would have been your discretion because you are the one who is going to give anesthesia. Many times I have seen the physician writing that patient is fit for surgery under spinal anesthesia or general anesthesia under short J, whatever it is. Now friends, in the eyes of the scrutiny of the law, they do not test the time tested. So even if they give a patient is okay, if you feel anesthesia per se or prospective, then you can give it. Otherwise, please do not give it. So it is not a mandatory. It is not a mandatory. But however, the opponent lawyer may be asking, the word you should remember that it is restriction of the anesthesia whether to take it or not. But if the comorbid conditions, they definitely will defend you. In one of the cases, probably many people must have read it, the BP was 150 by 100, ECG was non-specific changes. Cardiologist said that yes, patient is fit for anesthesia, and the anesthetist he gave a general anesthesia with endocrine for treating of the humerus. Interrupted cardiac arrest. Then automatically he called the cardiologist. Cardiologist certified the cause of death. The court said that where was the cardiologist when the cardiac arrest took place? He was nowhere. Then how can he give a cause of death? And both of you, hand in glove, you are not subjected to the postmortem. So both of them held liable. So in this case, 60,000 or 40% of the total compensation was for the anesthetist, 30% for the cardiologist, 20% for the surgeon who has not even started the surgery. Yeah.
So coming back to consent, I am still confused whether pre-printed consent is valid or not.
Now still they are valid, sir. They are valid. They are valid.
So we need not take in the patient's own handwriting and...
No, pre-printed means that's... No, patient vernacular language. I am talking about a vernacular language which what you have written should be known to the patient. If he is not understanding it, there has to be some interpreter. Interpreter also should sign it.
That pre-printed form should be in the vernacular language
Yes.
of the patient.
Yes, vernacular language of the patient. Yeah. Okay, thank you one and all. If you have any questions, you can take my WhatsApp number to the President and Secretary. I'll be happy to answer your queries in the days to come. Thank you, Ali.
Sir.
Thank you.
Just please, sir. Suppose if the patient does not know to read and write in his own vernacular language, then what to do, sir?
See, patient does not read and write. Okay? See, if it is emergency, you don't need to have it because under the IPC section 88, if you are doing good to the patient without the consent, even something goes wrong, you are protected. Second one is, in such cases, you take the opinion of the one more of your colleague and you take a signature. The third one is, if it is an institutional patient, the hospital superintendent or a principal or a dean, he can be informed. So these are the things, whether he is a deaf and dumb, whether it's a literate, illiterate, whether he can sign or not, that should be enough. Or else you can take a thumb impression of the patient by explaining all the things. Okay. Yeah.
What is the importance of audiovisual consent?
Yeah. This is very good. Definitely it has of late for the last 4 or 5 years because many times patients would say that we are at the tremendous agony what doctor was telling, we never know, but he asked us to sign it and sign it. And one more patient has said that at night they were giving me sleeping pills. What kind of sleeping pills? Had given a compound or alprazolam. So probably in that case also patient may not be understanding what the doctor says. He must have said that. And also they would bluff stating that, okay, I never knew anything about that. The relatives, they would not stand there. They would say that they never knew about that. So many things. Even the video counseling or video recording definitely has a role to defend yourself in the court of law. Wherever it is feasible, if you think that looking at the patient and patient relationship is going to be a litigant in due course of time, the best thing is you have a video recording also. Thank you.
Sir, my question is to I am a member and all. So 1986, the first time Consumer Protection Act was introduced. So that time also, have you done enough to protest against that? And now also 2020 modifications, are we doing enough? IMA is doing enough all over India to stop this act? Question to all the senior members.
Yeah, enough has been done from the IMA state and the national level. And even the Law Commission of India and Law Ministry of Parliamentarians, they appealed. That is a lot of work, but politicalized. That did not go through the. They were like nude spectators. Whatever the strike, the IMA did it. But I don't think, in the eyes of the parliamentarians, in the eyes of the politicians, our community is a micro vote banks. Okay, and unlike other professions, our strikes and all, they don't give desired yield, right? For example, if the lawyers, something happens to them, if somebody hurt, people have seen that, okay? The all bar associations, all the state would have been, but this doesn't happen in our case, okay? Probably you would say that with the bank bill you can start practicing, and then probably a couple of hours or one day you can this thing, but that's the thing, just forget about it. And we should come to our mind that, yes, one day I may be the sufferer, just like any of my colleagues. So, even in the long run, it has not yielded a good result, sir. Because even though it's the strongest and the biggest organization in the world, medical fraternity, but results are no way. And in the meantime, somebody asked me the other day when I was in Calcutta, as a general practitioner, as a physician, what could be the indemnity amount where it should be indemnified? So I would say that at least 1 CR should be the medical indemnity. At least 1 CR should be the indemnity. They have a good sleep. Because your indemnity policy is 20 lakhs, okay? If the compensation is of 80 lakhs, so 20 lakhs will be taken care of by indemnity. That's what the things you have to come from the pocket. So, since at least the state consumer is about the 2 crores, at least minimum 1 crore, especially depending upon the gynecology, anesthesia, surgery, physicians, it will be more than that. In this scenario, it's very difficult. It's very difficult to defend ourselves unless there is an indemnity. So I think probably the pan-India companies, pan-India, especially Rapid Medico-legal, it's a pan-India, okay? And I think they have a state bodies all over there, and I've seen that instead of midnight, 2 o'clock, 3 o'clock, the patient agreed party calling me, so and so it happened at so and state. Probably that kind of the association could be the more indemnified, and one among them is Rapid Medico-legal Consultancy. They have an expert panel of law, judges, retired judges, those who have done LLP and LLM, and they are doing tremendous job. Such kind of medical legal indemnity should be the more enough, I believe. Thank you.
Thank you. Thank you, sir. Now I request our President Dr. Madam to hand over the microphone and